If you want to learn about your heart, you don't want to bypass this morning's Carolina People. Coming up next. Good morning. Welcome to Carolina People. This morning we're at the Real Estate Career Institute on the corner of Highway 17 Bypass and Wachesaw Road in Murrells Inlet. We're focused on heart disease and stroke, and we're visiting with a cardiovascular surgeon from the McLeod Heart and Vascular Institute in Florence. Good morning, Dr. Jamie Holland.
Good morning, Greg.
Thanks so much for coming in and bringing some great props here this morning. It's nice to have a good setup early on a Tuesday.
Thank you. Thank you. It's great to be here.
Have you been down to Murrells Inlet before?
I have visited Murrells Inlet. Beautiful. I'm glad to be here once again. Rather be here under recreational purposes, though.
That's right. That's right. It is great to get down in the creek, and of course this Real Estate Career Institute and their amazing facility here. They're doing a lot.
Yes.
Doing a lot. Much like another institute, the Heart and Vascular Institute. You guys have been jamming up there in the PD.
Yes, we're excited about the recent initiatives that are underway, and a lot of prospects for growth and new technologies in the near future.
Absolutely. Are you originally from the PD, Dr. Holland?
No, I'm not. I'm originally from Indianapolis, Indiana.
Okay. Yeah, a little ways away, right? What brought you to the Florence area?
There's a lot really happening that's exciting in South Carolina in general, but also in Florence. I think Florence itself is a very dynamic medical community that has brought a lot to the forefront in medicine, not just catch-up medicine, but is actually leading the way in many areas of medicine.
Really?
Specifically with the heart, which is obviously my interest.
Right.
Electrophysiology, the treatment of heart rhythms by either catheter-based techniques, medications, or even surgical techniques are some of the newer areas that have been brought to Florence and leading the country there. Their heart surgery program is state-of-the-art, specializing in heart valves and revascularization of coronary arteries. There are just many exciting opportunities that brought me here. Also, it's a very nice community.
It is, absolutely. The PD area, and of course McLeod with its deep roots there, and of course you've got there's another great institution, Carolina's hospital system, and I'm sure a lot happening there. But McLeod is a community hospital doing so much to make a difference in that area, and they're big supportive groups like the American Heart Association and others in the PD.
Yes. We work strongly with the American Heart Association to make certain that the community is aware of what is happening in the treatment of heart disease, making certain that all members of the community are informed.
Right. There
is a tendency for focuses to be directed towards educational groups.
Right.
Seminars are directed many times at the professional groups, where our message is to the entire population. Make certain that every member of the population has the same information and the same access to heart care.
And so oftentimes folks think of heart disease and stroke as an older person's issue, which of course you found in your work over the years that it's clearly not just that.
Right. Acquired heart disease can affect anyone from in their early 20s all the way up to 90s.
Right.
I recently had a patient here, and the short time I've been here, my oldest patient here was 89. Interesting story, if I can digress a little bit. I hope this doesn't go off the beach.
Sure.
But I met her probably about 2 months ago. She had a younger sister who was 83, who had had a similar heart problem, had received consultation, and left with the conclusion that she was too old to have a heart operation. This had occurred within the same 6-month interval. This particular patient came in with a problem and had already made up her mind she was not going to have an intervention if it involved heart surgery.
Right.
Well, when confronted with the issue, it's either this or the alternative is not so pleasant. It left the family in a great deal of distress and disagreement. So half of the family thought she was too old, should not have the operation. The other half thought, okay, well maybe, but it caused a lot of controversy. So I gave her the information, left the room, and came back the following day. She was about 4'9", about this tall. And I'm 5'11".
Right.
She's standing at the foot of the bed. All the family's left the room. She looked up at me. She said, "Dr. Holland, this is my life. It's my decision. I want that heart operation."
Is that right? This 89-year-old.
89-year-old. Visitor in my office yesterday, decked out to the nines. She had makeup on, earrings, necklace, beautiful jewelry. Couldn't tell she had a heart operation.
Wow.
She reached up and gave me a great big hug and said, "I'm glad that we went through this." So it serves to illustrate that we're really not too old to have interventions with current technology.
Oh, yeah.
My youngest patient is actually 23.
Is that right?
For coronary disease.
Right.
For valvular disease, my youngest patient is 16.
I was about to say, we had 2 guests on in February who I think each called themselves blue babies or something that had occurred at birth.
Right.
And it obviously impacted them at a very early age. So
Exactly.
something they started thinking about. One, a young lady who's matriculating to Clemson in the fall who's had 3 or 4 open heart surgeries. Beautiful, pageant young lady. It was fascinating hearing her talk about flying to Dallas, Texas or somewhere. There's a great location out there where she's had a lot of open heart surgeries.
Right. Congenital heart disease means from birth we're actually able to diagnose these babies now in utero.
Is that right?
And so these operations are planned not because they're blue, we're planned because we know they're going to be blue.
Right.
And so we can time those operations at an appropriate interval to achieve the best anatomic and physiologic correction for that individual. And what took maybe 3, 4, or 5 operations historically, we can now achieve with 1 or 2. Now, I'm not a congenital heart surgeon,
right?
But there are some phenomenal accomplishments being done around the country there too.
Oh yeah, I'm so glad you brought some great pieces here. We want to talk some about the heart, but for viewers who may need to get off to work now or get out of the house, is there a good phone number for someone to call to ask some good heart questions, or even a good website for someone to visit? Is it the McLeodhealth.org site?
McLeodhealth.org is the internet access,
right?
And there is a home page which will direct viewers and patients to the appropriate site.
Okay.
For many of us who are older than the internet crowd in the 10s, 20s, 30s,
sure.
I like to use the telephone.
Yes.
And McLeod's switchboard telephone number is 777-2000.
Very easy to remember. 843-777-2000. Very easy. Okay.
And within the next 3 months, we will have a toll-free number.
Great.
A 1-800 number. I don't know that number at this time, but it will be widely published and accessible. That will be an opportunity for patients or physicians to contact a surgeon or cardiologist directly.
Absolutely.
At any time, day or night.
And I'm so glad you point that out, because so oftentimes we'll get guests in who want to promote their website, and virtually their website exclusively, but a heck of a lot of viewers who tuning in are just not going online. They're particularly not going online at 7:15. Right. And if you've brought up an interesting point, they want to pick up the phone right now and call somebody, particularly when you're talking about a 24-hour helpline for good cardiovascular or heart disease and stroke questions. And a lot of our viewers in the PD and down here in southeastern North Carolina are thinking about heart disease and stroke because it's impacting them, their children, their parents, their lives.
Well, to support that, Greg, I think that it's important for people to understand that, number one, we not only have developed the internet, which is invading or supporting all of our lives, however you want to view that.
Right. Along
with that has come the cell phone. And as people drive to work, the cell phone is there, and many people can just pick up that telephone and dial directly. I know we're not supposed to do that as well.
Oh yeah, no, sure.
But it's also become a part of our life. But more importantly to me is I've realized over the last 10 years of my profession that the average age of my patient has increased.
Right.
In the mid-1990s, the average patient undergoing a heart operation was somewhere in the neighborhood of about 58 to 62.
Okay.
Over the last 2 years, the average age of my patient is 78.
Is that right?
Yes.
Wow.
Yes. So when I think of my grandfather and grandmother when they were 78,
sure,
I can't imagine them logging on to a website.
Yeah.
But it's also difficult to navigate that, and the telephone is the preferred source for that demographic population.
Why do you think that age has gotten so much later? It sounds like groups, I'm so glad you mentioned your tremendous involvement with the American Heart Association. Groups like that are getting the word out to try to get folks more heart healthy and heart conscious may have seeped in as long back as 10, 15, 20 years ago to the present. Why do you think that the age would have creeped back to 78 as your average? That's fascinating.
Well, I think that's multifactorial. Part of it is, a great part of it is, I think people are very health conscious now. Mm-hmm. And particularly in this region, we have people who are out on the beach, people who are involved in exercise programs.
Right.
They're watching their diet. They're listening to their doctor's advice for the most part. Mm-hmm. People fall off the wagon every now and then, but it's a much more health conscious community.
Right.
And that's translating into increased years. And we want to see that continue.
Oh, yeah.
The other aspect I think that's equally important is that as a profession, we have evolved in our techniques and application of what we know of heart disease, and we're able to take on an older patient, which may not have been considered appropriate 10 years ago,
right,
with outstanding results. Think about cardiac surgery as a baby as far as technology is concerned. We did not really perform cardiac surgery to any degree of complexity until the mid to late 1970s. Mm-hmm. And the first operation that we performed on a regular basis was coronary bypass.
Right.
Think about that. That's just 30 years ago. That's not very long for any professions, particularly a health profession.
Oh, yeah.
As we have developed a greater understanding of the heart, and how our interventions affect other areas of the heart, we're able to eliminate many of the problems and complications that our forefathers in cardiac surgery couldn't even. And so we're able to offer much more than we did in the past. Even over the last half a decade, 5 years ago, we couldn't do the things that we're doing today.
Is that right? That dramatic?
It's developing the same way computer chips are. The growth is explosive.
That is wonderful. The funds are being found to do the research, to have researchers out there making a difference, whether it's great community hospitals finding the dollars to invest in research, or groups like the American Heart Association, or so many different ways to fund dollars into research so that you'll continue to see great things. Let's talk about the heart for viewers now on a Tuesday morning. It's about 7:15 who may want to know a little more about the heart. How does the heart work? How does it work exactly? You've got a great sample here. It looks like this is pretty well, maybe not to scale, but a good shot here.
This is, and looking at it from the camera, as a heart surgeon, that angle is what I see every day in the operating room. Now, let me preface by stating before I get into an explanation, most heart surgeries carry a risk that is less than a gallbladder operation. So when I encounter a patient, most of them are initially struck that they're not going to make it through the next day. But putting into terms that if I were a general surgeon coming in to say, you've got a bad gallbladder, I need to take that out, when can we do it, Doc?
Yeah, hurry up.
When you put it in that perspective, the risk is the same. Most heart operations can be done with less risk than a gallbladder operation.